Hi guys, this is Jackie Cooper. I'm with J. Cooper Travels, and today I have Dr. Brown here again. This is a continuing conversation that we're having on our wellness and how do we stay healthy, both for, activities that we do locally as well as when we start to travel again. And today's topic is something that's, really important to everyone right now. It's all about COVID, and it's also all about the COVID vaccine, which we are, going to be having access to within the next month or so as they roll it out. For those that are not familiar with my podcast, I have a few podcasts. My background is that I have a law background. I'm also a special educator, and I'm also in the travel space. So I started to travel because I love going on different adventures and experiences to meet people around the world. But I know that with COVID and us having staycations right now, my podcast is not just about where we can go, but also about our own personal journeys, both, within careers as well as, our other internal reflections. And at the beginning of a new year, it's always good to reflect and figure out which direction we want to go. But I'm gonna have Dr. Brown explain a little bit more about her practice and the topic of the day. Thank you so much, Dr. Brown, for being here. How are you?
I'm good, and you? Thank you for having me. So, our topic today is about COVID vaccines because they're new, coming out, and we still don't know maybe a lot about them. So, me and Jackie wanted to bring a brief topic to you about what we've learned about it so far. Mhm.
So tell me a little bit more about your background, though, and how you got started. Because some of the individuals who are listening, we've had a number of continuing conversations on how to stay healthy, but they might not know about your background.
Yeah. Okay. So, I'm Dr. Tiffany Brown. I'm a naturopathic doctor, and so I got here through my own health journey. And I had women's problems, and like I said before, I was going from doctor to doctor. They was doing what they were supposed to be doing, and I just wasn't seeing any results. So I looked over into the natural world to see what they were doing, and they were doing a lot. I got overwhelmed, but I tried one thing, and it worked, and I saw results. So I knew it didn't fix me. So I was trying to look around to see if any holistic doctors or naturopathic doctors were in my area, and there's none. So I said, okay, I can do this. I gotta be that one. So I went to school. 4 years later, here I am with a virtual online business where I can see patients from anywhere.
And for those that would like to reach back out to Dr. Brown after our podcast and also YouTube, there will be contact information. But Dr. Brown, in case someone's driving or doesn't have access to a pen, but they might want to try to remember your website or way to contact you, what's the best way for them to reach out?
Yes, the best way to reach out is my website is ND Health Calls. That's ND as naturopathic doctor. I'm on Facebook, so you can hit me up through Facebook. And that's my main social media that I use, but I'm on all of them, and my contact information is on all of them. So either phone or email, uh, they all on there. So either way, I'm available.
That sounds great. All right, so let's get into the topic of the day.
Hmm.
So COVID-19 vaccines.
Hmm.
Which vaccines have been approved? How many have been approved?
Hmm.
Go ahead and share information because I've heard a lot in the media, but I'm not really aware as to, the different types.
Yeah. So two vaccines have been approved, and that's the one for Pfizer and Moderna. Those two have been approved so far, and a lot of the information I'm gonna talk about is from the CDC website, where seems like that's the heck is keeping up with the most current information. So these two vaccines, they operate different from our current vaccines, because our current vaccines use like either weakened part of the virus or they killed virus, and they inject it into the person and for the allergic reaction to happen. But these two vaccines are something new that we've never seen before. But it seems like from the trial so far, And it must be good because the United States, the FDA has approved it. So the FDA has approved it. It's not approved through the FDA, but they have approved it for the emergency use of it. And these two vaccines are in the third phase of clinical trials as well. And they're 2 months into that. So these two vaccines work like they have the messenger RNA of a piece of the coronavirus, which they call a messenger RNA. And they put it in fats. And I think they got a sugar attached to the messenger RNA. So when it injects inside of, when you inject it, it goes into the cells, our cells, and the cells, because the cells are lipids, and this virus is coated with lipids, it actually can fuse through our cells and enter in. And then that messenger RNA is a message for a protein, and it codes for the protein to make spikes on the outside of the cells. So then that causes our body to have an immune reaction. And that's the whole projection of this virus. And with the immune reaction, we're hoping the body, they're hoping the body produces immune reaction plus antibodies that will help fight it off the next time it sees this virus again. So that's what they're doing. And so this vaccine is approved. Pfizer is approved for 16 years and up, and Moderna is approved for 18 years and up. They just have a few different ingredients, but they both operate the same.
So, are they both like 2-shot vaccines, or can you only get one?
Well, they're 2 shots. So you'll get one, and then the Pfizer is you get your first one, and then you'll get that one 21 days later. And the Moderna's is also a 2-dose vaccine, and you will get the first dose, and you get the second dose about 28 days later.
Okay. And how do they decide which one to give you?
Well, because they both approved, I think whichever one, the location where you get your vaccine at is whatever they have. And then your second dose should be, they want it to be the same vaccine. But then when I'm seeing in the media, it might not be the same vaccine. So because they're getting short on the doses now.
So, what are the symptoms that may occur after each vaccine, and are they similar, or are people finding it different?
So after the vaccine, your symptoms are ranging from fatigue, fever, chills, muscle and joint aches, body aches, and things like that. Those are like flu-like symptoms, which might happen 2 days to about 2 weeks later after this dose, your first dose. And I was looking at some of the research. With the second dose, those symptoms might be a little more severe. So just be expecting that, and maybe consult your doctor as into what to take, if anything, if these symptoms occur. And then you could have allergic reaction to it. So you most definitely want to tell your doctor if you're allergic to anything, even though if they know, tell them again anyway, that you're allergic to this, and tell them your health conditions. So the doctor will know how to address you. Because I know some people, I'm getting questions about, I have autoimmune condition, should I be taking it? Or I'm immunocompromised. Those questions like would kind of steer your doctor either way or not into if you should take it or not, and then give you good advice if things happen, if something happened, and what to look for. Because if you have a allergic reaction, it might be something small as is, you're getting hives breaking out, or it could be your throat feeling like it's closing, or you getting shortness of breath where you need to dial 911 and get the emergency people in route. So most definitely consult your doctor about with those underlying conditions, what you should do, if you should or
So,
should.
and I know you might not be able to speak to this, but we always have to talk about the possible consequences of taking a vaccine. But from what the media has been saying, though, that's kind of a small percentage, I would think, of who actually has a reaction. What's your knowledge of, because normally the vaccines are relatively safe. So what's your knowledge about, these two vaccines?
But about these two vaccines, they seem like they're safe. That is new, and we've never seen this type of vaccine before, so we don't really know what to expect. When it, me just kind of reading some of the what CDC is saying, seem like it's okay, but they still have questions about most of them let your doctor know if you're immunocompromised. And I was reading somewhere where if you are immunocompromised, where your immune system, or if you on immunosuppressant drugs, you might not get much of an immune reaction if you did take the vaccine because your immune system is already weakened or decreased. So it's just right now we just don't know, but people are getting it, your doctors, your nurses, a lot of frontline workers are getting it. And it's not much, there might be some issues going on, but nothing I think is serious, because no one has came out and said, uh be careful and not take the vaccine.
Well, I guess the idea is also the consider what the consequences of not taking the vaccine is, because of the
Mhm.
idea that if you do get COVID, there's a whole range of conditions that you could get. So you have to kind of weigh vaccine, no vaccine,
Yeah,
because then you might be exposed to COVID
yeah.
without any protection.
Exactly. Yeah. So yeah, and that's so true. And I think it's where we see a lot of people they're wanting to take it, and some people are just they just don't know what to do. Um, I just figure like some people have taken vaccines in the past and maybe had a little something going on, and they're willing to chance it this time, and that's fine. All I say, just talk to your doctor. And then also too, after you get the vaccine, if you've had allergic reaction, because you want to let your doctor know if you had allergic reaction in the past or if you're allergic to anything, you should stay in the office or somewhere for 30 minutes after the vaccine, because you can still, something could occur and you want to be right there. So CDC is saying, stay in the office or the building for 30 more minutes after the vaccine, just keep watch on you.
So we were talking before we started the recording that these vaccines they weren't made from eggs. They don't
Mhm,
have preservatives,
mhm,
and
mhm.
what was the other thing? They don't have latex.
No, no latex.
So that's not something that individuals need to be concerned about from an allergic perspective, because in the past, vaccines might have that, and then if you had any sensitivities to those, they would always caution you.
So true.
Um,
So true.
so anything else that you want to share about the vaccines? I know you had mentioned CDC, so we'll have a link
Mhm.
on the podcast, so that way everyone can go directly there to check
Mhm.
out the information.
Yes.
And then the other thing is definitely reach back out to Dr. Brown. If you have questions, she can consult with you in conjunction with your doctor,
Yes.
because she has experience in different areas. But anything last minute thing that you want to share with our listeners?
Yeah, if you have any questions, or if there's some things health wise that you want to do before you take the vaccine, most definitely reach out to me, because we can do some holistic things, get some things going to help you out in that regard. If you just want to talk, or if you have questions about anything, most definitely reach out to me.
Okay, that sounds great. And again, Dr. Brown's website, in case you weren't able to get to it at the beginning, is ndhealthcalls.com. And that information will also be in the block below for the YouTube, as well as the podcast for Jay Cooper Travels. And then you can also reach out to me, jcoopertravels@gmail.com, if for some reason you are not able to reach out to Dr. Brown. And definitely like and subscribe to both the podcast as well as the YouTube, because we are going to have continuing conversations all year. And just so you know, I'm going to try to pop these out on Wednesdays. I'm going to be calling it Wellness Wednesday. So that way you'll be able to have continuing conversations and tips throughout the year on how to stay well. Because again, I know every year we have our New Year's resolutions, and it's always dealing with health, wealth, and relationships. So the three major areas. Anyway, thank you so much, Dr. Brown. I will talk to you soon.
All right, thank you, Jacqui.